Coming up on Why Should I Trust You? On a big news week for health and medicine, as questions swirl around the childhood vaccine schedule, the administration now raising alarming questions about the safety of the COVID vaccine, and public health expressing outrage over what they're calling irresponsible, baseless claims, we sit down with a group of people deeply committed to health and medicine and faith to ask, how do they see this moment, and how can we pull ourselves back from the brink? Joining us are names like Dr. Francis Collins, former head of the NIH, Dr. Mark Siegel, Fox News senior medical correspondent, Reverend Wendy Silvers, faith leader for the Kennedy campaign, Jennifer Gallardi, senior policy analyst at the Heritage Foundation, and others from MAHA and from public health. Today we ask, how does their spirituality and faith shape the way they see this moment of dramatic change in health and science? On vaccines, on global aid, on mRNA technology, on chronic health, and on scientific expertise itself. Ultimately, if religion and science are both attempts to make sense of our reality, to try and understand truth, could conversations with those we disagree with, yes, strongly disagree with, about faith and seeing health through the lens of faith help get us closer to the central question of this podcast? Why should we trust one another? Let's get started. Welcome back, everyone.
Yeah, welcome, everybody.
So, guys, this is a conversation we've been looking forward to for a long time. And given how fast our guest responded to say yes, they were in, I think that excitement was not just limited to us. I got texts over Thanksgiving break about this podcast episode. So I'm really excited about this. But first, who is the us? I'm Brenda Adhikari.
Yeah, I'm Tom Johnson.
I'm Maggie Bartlett.
And I'm Dr. Mark.
And this show, if you are new, is all about the breakdown in trust in medicine, public health, and science. And it's something we explore through a wide variety of subjects and with voices from all sides of our society's dividing lines. And today, that means, I guess, we're going sacred over secular, Brenda.
Whoa. I like that. Sacred over secular.
Moderation.
There's going to be a bit of secular and sacred, I think, in this little mix. We did have the conversation. It was really interesting, guys. I'm not going to lie. It's like right up there with some of our most interesting episodes, I think. And you might be wondering why we even decided to look at things through a lens of faith. I mean, honestly, faith is the lens through which so many people in this country, as we're about to learn, do look at their lives. And so we thought it was kind of an opportunity for us to talk about a lot of the issues that we talk a lot about on this podcast, from vaccines to how we view expertise to a lot of just timely things that we talk about, but viewed through the lens of faith. I mean, I just found it fascinating. Like we'd mentioned, this is a busy week. The Advisory Committee on Immunization Practices, known as ACIP, is meeting as this episode goes to air. And for full transparency, we're recording on Monday, but this is airing on Thursday. And there was news over the holiday from the chief vaccine czar, if you will, for the FDA, Dr. Vinay Prasad, who is alleging that there were a number of COVID deaths as a result of the COVID vaccine in children. And of course, it's a very controversial assertion, and we're still waiting for any supportive data to be released to back up these claims. And just so you know, early next week, we are going to be taking up ACIP as well as this letter from Dr. Prasad. We're going to be talking about that in a few days from now. So stay tuned for that. But yes, today's episode, faith was so front and center. It's not all that surprising because as we've been exploring the MAHA movement, getting to know so many of you who are MAHA followers, your spirituality and very often Christianity is very near the surface. You speak with someone and they might open up and speak about their faith, their religion, and how it's inspiring or guiding them in their mission to make America healthier. It's like their spirituality runs parallel to and is mingled with their passion for MAHA and the changes they want to see in health. So we're going to get to that conversation. So just a really good group. But Tom, before we kick it off, let's set the table. Like, where are Americans these days when it comes to faith?
Yeah, it's a good question. The biggest survey in Pew's arsenal is one that actually tracks the faith of Americans. And it's called the Religious Landscape Study. And they first rolled it out back in 2007. So over the past 18 years, you can pick up on trends. And the first is that Christianity has been on the decline. In 2007, 78% of U.S. adults identified as Christian. By 2023, that number had dipped 16 percentage points, with just 62% of the nation identifying as Christian. And then something interesting and unexpected occurred. That drop stopped. So during the past 5 years, the decline in Christianity has stabilized, including the largest subgroup of Christians, Protestants. And at the same time, when it comes to the 7% of Americans who identify with other religions, those numbers overall have been going up. And that includes the 1.7% of American adults who identify as Jewish, the 1.2% who are Muslim, the 1.1% who are Buddhist, and the 0.9% who are Hindu. To round out this tour of faith or not faith in America, 29% of respondents in Pew's latest survey say they don't identify with any religion. And after years of that number rising, that number has now leveled off. So it's interesting that at the same time that faith in America seems to be stabilizing, as we note every week in this podcast, faith in science seems to be declining.
Right.
And of course, this is just a correlation. It's not causation. But it does nudge us towards a question, which is, how does religion impact our views of health and science and where we are going? And this came up during the pandemic, during the race to get people vaccinated. So we're talking back in 2021. And polling early that year revealed that nearly half of America's 41 million white evangelical Christians said they would not be getting vaccinated. And that made them one of the most COVID vaccine resistant demographic groups in the country. And that was an eye-opening phenomenon at the time. And the subtext was pretty clear, which was, for a big group of Americans, their religious worldview was colliding with modern medicine.
Yeah, Tom, around this time in 2022, researchers at Baylor University and University of Texas did some really interesting research. They found that the belief in an engaged God, one that actively is involved in daily life, was linked to mistrust of COVID vaccines. The author suggested that for these believers of an active, involved God, their trust actually shifts from scientific and medical authorities to God's guidance.
Yeah, that is super interesting. And we're years out since the pandemic. And, of course, we've watched how more and more Americans view our medical system as being rigged and making us sicker. Obviously, that Navigator poll that we dove into back in the fall, showed us that there's big majority of Americans who just feel like the whole thing is rigged. And at the same time, Pew finds that 58%, so more than half of all U.S. adults, say their religious beliefs right now are in either some or significant conflict with mainstream culture. And that number is up 10 points from just last year. So something is brewing here. We have this growing appetite for faith as a source of trust and meaning in our lives. We feel like our religiosity is more and more in conflict with mainstream American culture. We have a vast majority of Americans who are not happy with the current system of health in this country. And we have this crisis in trust in public health and science. And so that kind of lands us on this question, which is, can talking about our faith, can sharing our faith actually help us to rebuild some trust? Because we have a ton of work to do.
So we want to tell you a little bit about this conversation, but basically, the way we set it up was we had 4 people who would call themselves supporters of the MAHA movement in some way or the other. We had 3 people pretty solidly representing public health. And then we had 1 journalist who's also a doctor, and he is from Fox News. And then it was the 4 of us on the podcast. And it was a diverse group of people. What you'll find is that they're going to introduce themselves. We had a section where they kind of tell us who they are and about their faith journey. And then we kick it off with a question, much like we do in a lot of other episodes. So I'm going to just read you the names here, but then they're going to introduce themselves. So like we said, you had Dr. Francis Collins. Next, we've got Dr. Mark Siegel, who, by the way, happens to have a book out right now, which is pretty related to this topic. It's called The Miracles Among Us, How God's Grace Plays a Role in Healing. Reverend Wendy Silvers, Jennifer Gilardi, Emily Smith, Mackenzie Isaac, who goes by Kenzie. I want to give a big shout out to Kenzie for pitching this idea. Jacqueline Capriotti and Elizabeth Frost. We know it can be tough to kind of follow the conversation, but we do find that these big groups, there is quite a bit of energy on these calls and a lot of kind of shared feelings of camaraderie that people find in seeing a bigger group. So that's kind of why we do it that way. And we are really glad that you're going to be joining on this. So coming up next, we'll have the conversation.
Hi, I'm Jacqueline Capriotti, and I'm from New Jersey. I'm a mother of two adults with cystic fibrosis, and that journey has actually been a big part of my journey through faith. My relationship with God was just kind of still that I just felt like there was a higher power, but there was nothing there. But as the experience went on and I started experiencing the miracles of what was happening to my children, even though the hard things that were happening to them, the things that were getting fixed, the doors that were being opened to me, the relationships that I was developing with their medical team and with other patients and other parents as well and caregivers, all of those doors started opening that I felt like looking back now, I feel my relationship with God started opening at that point. I've been very active in paying attention to health politics and very active in paying attention to finding those answers as much as I can to serve my own children. So during the pandemic, when I heard Kennedy speak about mitigation and about that it's not across the board, that we need to be able to be a little bit more specific on individual classes of people. So people who are vulnerable need a little more mitigation to protect them from the virus. These type of things really kind of opened up my ears and started listening to him. When Secretary Kennedy announced his presidency, I felt it was an opportunity to really elevate the conversation about health in general. I really liked some of the things that he was saying. I didn't agree with everything, but we don't agree with everybody all the time anyway. But there was a lot of things that he did say that rung true to my own experience. So I dove in and I volunteered with the campaign.
Well, hi, I'm Francis Collins. I am currently retired from NIH. I started out my scientific career actually trying to find the cause of cystic fibrosis back in 1989, where that gene discovery was possible. It was really hard back then to sift through 3 billion letters in the human genome and find just one or two, or in this case, three, that were misspelled. Things have come a long way since then. I was given a chance then to come and lead the Human Genome Project, which I did for some 15 years. And then was asked to be the NIH director and served three presidents, Obama, Trump, and Biden, for a period of 12 years, stepping down from that at the end of 21. So that means I was NIH director during that very tumultuous year of 2020 with COVID-19. I, after that, went back to running a lab at NIH, working on diabetes and a rare form of aging called progeria. And then I was, let's say, made rather unwelcome at NIH back on March the 1st, and ended up in my current retirement aiming to try to get more messages to the American public about how medical research works and why it might be something you'd want to care about at a time where there's a lot of things happening right now that, from my perspective, are potentially slowing us down. I'm a person of faith, but I didn't start out that way. I grew up in a home where faith was not considered very relevant. I was an atheist as an undergraduate and then as a graduate student studying physical chemistry. And then I had a change of heart about science and decided to go to medical school. I entered medical school as an atheist, and I left as a committed Christian. I'm a follower of Jesus. I came to that over a 2-year period of sort of struggling to try to figure out, why do people believe this stuff? And gradually becoming aware that it made more sense than my atheism did. And the person of Jesus became for me such an anchor into everything that I wanted to know about how the world was created and how I'm supposed to live my life and answer those questions about, why am I here? And is there a God? And what am I supposed to do with my little eye blink of time here? I've never seen a conflict between science and faith. I think of both of them as ways of investigating truth. And I find that to enrich the experience of being a scientist, because it's sort of like the laboratory is also a cathedral. But it also enriches my experience as a person of faith to know that God gave us creation and gave us the curiosity to explore it with science, and if possible, to use that in a way that alleviates suffering and heals people, which Jesus spent a lot of his time doing, and I think we were supposed to notice.
Good morning, everyone. I am Reverend Wendy Silvers, and it is my joy and honor to be here. My journey to faith, I was just born with a with a hunger to know God. It was when I was a child, it was talking to trees and being aware of nature and being aware that there was something bigger than me that was here, that I just remember being so conscious that there was more to this world than my family. I didn't come from a family of faith, but my desire, my yearning to know God in my bones and to really even know what this presence was that's called God. I just had this desire, this burning in my heart to know love, which I believe God is. And so I just began my trajectory. Not a lot of people in my family felt the way I did, and not a lot of my friends. I ended up actually in PR, but in the entertainment industry for quite a while. But I was always with this hunger to understand what's underneath, what's behind, what's this power, this presence that I can feel, but I may not be able to name. And then as I continued through I would say, my spiritual journey, I came to Los Angeles and I became a spiritual therapist and subsequently an ordained minister. I love the teachings of Jesus, and I believe it's the living of the teachings of Jesus that really opens your heart. Jesus, Mary Magdalene. So through my work, I've been leading prayer circles, and my specialty has kind of been empowering moms, women and moms, to really stand in their God-given power as leaders, because when you are a mom, you're actually the leader of your home. You are the heart of your home. And I was invited to be part of the Kennedy campaign as the faith-based engagement team lead. And I did that, and I believe that was a really wonderful experience to understand. I had been behind the scenes involved in empowering families for many, many years, and especially with the health freedom movement, and then to be on a campaign of somebody who was courageous enough to challenge the status quo, and to do so with such a commitment of faith really spoke to my heart.
I am Dr. Mark Siegel. I'm a professor of medicine at NYU Langone Health. I run Dr. Radio on Sirius XM. I'm Fox News' senior medical analyst. A couple of random thoughts. I have a piece out last week, How Faith and Gratitude Can Still Work Wonders in a Fractured Nation. I think that that's part of what we're doing here today. I think Secretary Kennedy is a man of great faith. I think that Dr. Francis Collins is a man of great faith. I often think, since Collins is one of the greatest geneticists in history, what it looks like to look at the human genome like he did. He didn't mention that just now. And I think those are God's fingerprints on the human genome. And I found my faith, I think, in a non-medical setting first. When my first son was born, I was like a lot of fathers, I was in a state of confusion. What is my role now? What do I do? And I'm walking down the street and I see this man with a prayer book praying, and he hands me the prayer book and he said, "Pray for the health of your newborn son." I said, "What do you mean? How do you know I have a son? How do you know that?" It was such a spiritual moment that I then became more religious as a result of that. And the second vignette I want to tell you about, I have this new book, The Miracles Among Us, which is doing extremely well. The president just tweeted out about it last night. I'm very touched by that. But the second one was a medical situation I had as a young resident. When I was just starting out, there was a man in the ICU that had had a head injury, and he was in a coma for 3 months. And the family was at the bedside the entire 24 hours of every day saying, "Look, his blood pressure's going up. Look, his heart rate's going up. Look, he's breathing a little faster. He may be waking up." And all of us stood there, and we weren't making fun of the family, but we were like, come on, can't they face reality? Can't they see that he's not going to wake up? After 3 months, he suddenly woke up out of that coma, walked out of the hospital and went back to work. Changed how I looked at medicine and faith. Just one event like that in your medical career. And so in my book, I look at that exact issue. How do miracles, when they occur, affect doctors who are participating in them? They may be non-believers before, they may be non-believers after, but they're touched by their experiences.
Hi, good morning, everybody. My name is Mackenzie Isaac, but friends call me Kinsey, so please feel free to call me Kinsey. They say that some people are born with a silver spoon in their mouth. I say I was born with a church fan in my hand. I grew up in the Missionary Baptist Church, the Black Baptist Church, and I was basically voluntold to sing my first gospel song solo when I was about 3 years old. And though I couldn't put words to it then, I find that the specific way that the African American church worships is something that's deeply healing and restorative for me, even today. Even during the seasons of life where I had, for lack of better words, fallings out with God, I think that I'm very fortunate that the specific church that I call home never openly opposed science. But the reason that I wanted to come to the table today is because a huge refrain I heard every time someone was sick, every time someone was dying, is that, God is your doctor and the church is the hospital, and we never lose a patient. And I wondered how that thought process was both uplifting and contributed to healing, but could also lead to some confusion, especially for young people like me in 2020. That mindset that God is your doctor who never loses a patient led to some things like major vaccine hesitancy, led to some major things like fatalism, when there were definitely measures that could be taken to save people's life and to make the community better. But that aside, I will say that my faith reached a crossroads when I was in high school. I had severe anxiety throughout high school. And I lost someone extremely close to me due to their own mental health struggles. And I was very angry with God for a very long time. Why did something so heartbreaking, widespread tragedy, why did that happen to such a good people, to such a good person, to such a good system of care around that person? So I chose to go to the University of Notre Dame for undergrad because I was holding on to my faith essentially like a life preserver, not really knowing how to swim yet in my faith, but there was this desperation to try to find that answer. And when I left Notre Dame, without an answer, but with more questions, I saw the parallel between that and science pretty quickly. Just the divineness of never knowing for certain. That's what makes us human. And as frustrating as it is, we're all undergoing that same journey. And so I'll just end here by saying, before I hopefully get into detail with everyone else further along the conversation, is that the African American church is predicated on this idea of liberation. And every science venture, health education venture, health justice venture that I've been on has also been an act of liberation. And so I cannot separate my work from my faith worldview. And something that I hope that we cover today is the fact that the most segregated institution across racial lines in the United States still remains the church. And I have a huge suspicion that racial disparities in health outcomes is also linked to that in some ways. And I think that it's so important for so many people with lived and professional authority on here to think about that.
My name is Jennifer Gallardi. Thank you so much for having me today. And I was actually baptized Greek Orthodox at 6 months old, but my parents did not raise me within the faith. So I did not go to church regularly. My yaya, or my grandmother, Greek for grandmother, was fairly faithful. So I would go to the Pascha Mass, which is the Easter Mass and probably the biggest holiday for Greek Orthodox. It wasn't an established presence in my youth, and I was always one of those annoying kids who wanted to know why. Unfortunately, the kind of discipline I grew up with was never centered in God. It was never because this is what the Bible says. It was just because I said so. So I think through that, I grew a little bit of a rebellious streak. I went to school at a very conservative institution in Virginia called Washington and Lee University. Then I went to Birmingham, Alabama, and everything just felt very small to me. And I decided to, pursue my dreams in Los Angeles, California. I kind of ditched my public policy undergrad degree and ended up in the LA entertainment / kind of dance world. I was a dancer growing up. Anyone's been out to California, Wendy, I'm sure you can relate to this. That kind of spiritual pursuit is very popular out there. And unfortunately, it led me down some very not wonderful paths, but in some ways wonderful, as God uses all things for good, as we know. So I ended up kind of in a yoga cult. I'm skipping forward many, many years of Los Angeles. But I was always pursuing God. Like many of you that have mentioned, I think there was always a curiosity in my heart to want to know God and who God was and understand meaning in my life and purpose. So I ended up in kind of the fitness and health space, had a career in that space, kind of on the entertainment side of it, not entertainment, but on camera, a lot of on camera work. And throughout all that, kind of just pursuing all of these various spiritual paths, from Buddhism to yoga to Tantra to eventually psychedelics. And I think there was a lot of split between my body and my mind. I began to have this kind of biological spiritual split, which came to a head during kind of COVID and seeing the madness, particularly in California, around the policy around me. I figured I was done doing what I had done in my career out in Los Angeles as far as being in the fitness world. And I had a Jesus moment, actually, in one of my very long morning meditations that I thought I had to do every day to be a good person, sitting there for hours. And Jesus, I still get a little emotional, sorry. Whoa. Jesus came to me and said, "Welcome home." Sorry, this hasn't hit me like this in a long time.
Jennifer, take your time.
And I just knew that I had to go back to the faith that I was born into, that I had to go back to my family that I had disconnected with in California, that I had claimed were all these caused all my trauma, and when they were wonderful people. So after kind of a short stint in just a vague kind of Christian non-denomination, I returned to the Orthodox Church. And even though it's not apparent right now for this, I'm very happy. It kind of changed my life. That stability that I found in tradition, and the stability and groundedness that I had so lost being out in California, that I found from ritual, tradition, the incense, the liturgy, and that I didn't have to work so hard to find God, that it didn't have to be flying off to India twice a year or doing ayahuasca journeys, that he was present in my life every day through Jesus. It coalesced to me back my body, my spirit, and my mind, which had kind of been severed through these other spiritual pursuits. So I also returned to school to Pepperdine to get my master's in public policy. All that said, I now work for the Heritage Foundation in our Restoring American Wellness initiative. Restoring American Wellness is really, our initiative to support mostly the MAHA agenda, but also to offer constructive criticism, because we are a policy institution. So we want to support good policy, and we want to be able to debate policy that we'll disagree with potentially, and really to kind of, Heritage is often thought of as this far right conservative, and it's not unknown that we are conservative, but we think that the Restoring American Wellness Initiative, the MAHA initiative, what we saw is this fundamental political realignment that brings in the left and the right. And we might disagree on a million other things, but there's some things we agree on. And can we work towards solutions where we do find agreement that benefit the most? And finally, I'll just say, with public policy, even though I work for a public policy institution, I actually don't think policy is the ultimate solution. I think it's kind of the best thing we can do to kind of bridge the gap. But I do think the solutions really have to be based in, we have to rebuild the institutions that this country was founded on, which is faith organizations, veterans associations, the little platoons, the things that Edward Burke called the little platoons of society. And the more local you get, the easier that is to do. My faith informs my work every day. So sorry for the for the emotional breakdown.
Hi, my name is Emily Smith. My faith journey, I grew up in the church. My parents were lay leaders, worship leaders at our non-denominational church. So a little like Kinsey, I just was born into it. And I was really fortunate to have good church experiences. I healthy church experiences. I went to a Baptist college in the panhandle of Texas and met my husband there, who is an evangelical pastor. And I remember early on, like 6 years old in kindergarten, when they ask you to make those things of what do you want to be when you grow up, and you have to draw something. I said I wanted to be a singer, and that did not work out, and it's fine. But the other, I wanted to be a missionary, because our home was the home that when missionaries would come to the church, I would get kicked out of my room to stay with my sister, which was fine, and we would host the missionaries. And I just remember being 8 and 9, just peppering those poor people with questions about the adventures, and I was enamored. So I just wanted to do global health somehow. But I also loved science, like Nerd Central loved. I read college textbooks about DNA. Dr. Collins, that one was for you. In my 9th grade year, I did science fair, and I felt a little called to the ministry. So I thought maybe the only way to put both science and faith together is to go to medical school and be a medical missionary. So fast forward a little bit, I got into medical school, but my husband's first job as a pastor was across the country, and I had a gap year. And I decided what every good pre-med person did was get another degree, and that was in public health. I never heard of epidemiology at the time. But my professor said, epidemiology is the spread and distribution of disease. That's the technical term. But he said what it really is finding the people who are most at need and choosing to do something about it. And my little faith upbringing, I went, that's the story of the Good Samaritan. It's a science of quantifying who is most at need of something with health, and then choosing not to walk by. And I was hooked. I pivoted. I got a PhD in epidemiology, which is what I do now. I'm an associate professor here at Duke of global health and epidemiology, looking at the intersection of poverty and children's health care in places like Somaliland and Burundi. Why I probably am here now is during the pandemic. We were in Texas at the time. My husband was at a really large evangelical church as the pastor, and I tend to be an overhelper. And so when COVID, early 2020, we as epidemiologists are trained to know what's happening in Wuhan could be really bad. And so I started a Facebook page called the Friendly Neighbor Epidemiologist. Friendly because I can be overly friendly at times, which sorry if I sit by you on an airplane, but neighbor because what we were seeing in Wuhan, this disease was going to be something different than like Ebola, which a lot of us had just combated in West Africa. Because when someone is sick with Ebola, you know they're sick. It's a little easier. Ebola is not highly deadly, highly fatal. It is without lack of health care. This looked like it was sneaky in how it was infecting people. So I named it Neighbor, Friendly Neighbor Epidemiologist, not after Spider-Man, which I get that all the time, but because it was going to take us neighboring one another. This concept of the Good Samaritan, the people who are on the margins of healthcare access or poverty, or the children that my work involves with cancer in Tanzania, they're going to be affected a lot more than those with privilege. So I thought, gosh, what a time for us to come together as the church, neighbor one another well, and let's get through this.
Hi, my name is Elizabeth Frost. Just a quick background on me. I worked for Bobby Kennedy's campaign up to the point when it ended as state director in Ohio. So that's kind of my tie-in, the connecting piece of me to the MAHA movement. After the campaign ended, myself and a few of the volunteers that were really helpful in our state kind of banded together to organize something we call MAHA Ohio. And we are a grassroots organization that focuses on building relationships with our representatives, with our leaders. Like Kenzie, I too grew up with a church fan in my hand, and my grandpa was a pastor at a local, very, very, very small Southern Baptist Church. I was very blessed, like some others I've heard on the call, to have had really positive church experiences growing up for the most part. I really developed a strong relationship with God in my later high school years, and to the point where anytime I would notice that I was feeling really anxious or sad or stressed or lost or depressed, all these normal teenage girl emotions, I would always find myself going back to, what was I doing the last time I was happy? What was I doing the last time I was at peace? And the answer was always very clear. I was praying more. I had a stronger relationship with God. I was trying to live in his will and not my own selfish will. I'm a child of the opioid epidemic, living, kind of in the epicenter of this. And so, seeing those through lines with corporate capture was very much, corporate influence was very much, I think, kind of the force that drew me to Bobby Kennedy in the early days before he was, even running for president. But he was starting to hit the podcast circuit, and I was listening to a lot of what he was saying, and someone was putting into words what I had experienced, my own lived experience. I was hearing someone put it into words for the first time. And so that was very profound for me. But so I found myself praying again. And I was sitting on my couch one night in probably summer of 2023. And I prayed to God. I said, is this legit? Is he a good man? Is he evil? What is this? And I very vulnerably was prepared to trust whatever God told me in that moment. Profoundly, like nothing I've ever heard before, something came over me and said, you need to do everything that you can to get that man elected. That's a divine order. And this is the first time I've actually ever told anyone about that moment publicly. My mom knows. That moment shook me to the core. I didn't tell anyone about it for probably 6 months. But the reason that I didn't share that was because it was so deeply personal to me that I did feel like I was on a mission from God. And I knew that without having that relationship with God, it's hard to understand. It's difficult to understand why I would believe that so earnestly. But also at that point in time, I worked on various political projects, and I would say I was politically engaged, but I had no idea what to do to get someone elected for president. There was an immense pressure because I had been given a divine order. And so I was really racking my brain about what can I do? What should I do? So I began, volunteering for the campaign just a little bit, here and there. And then pretty quickly, a position for state director had opened up, and everything fell into place from there.
So, to kick us off, I wanted to read a quote that Secretary Kennedy, who's currently the head of HHS, said, just to kind of get your thinking on this. He said a version of this multiple times in different interviews, but he has said, quote, trusting the experts is not a feature of science. It's not a feature of democracy. It's a feature of religion and totalitarianism. As people of faith, I'm curious what you hear in that and what you think of expertise and institutional authority. And I wonder if I might start with Jennifer Gallardi on that. What did you hear in that quotation?
Well, I think it's important to understand the context in which this was probably stated. It maybe came out of a response to the COVID policy, which we know was, I think, absolute failure in a lot of ways. So people lost trust in the institutions that they used to covet. I think the point he's trying to make is that there's a difference between looking for guidance to our governmental agencies, and I should not confuse that with institutions, but looking to guidance to our governmental agencies and to have this blind faith that everybody is acting in good faith, that there aren't some perverse incentives in the government, whether that be money or power. I mean, the quote, I believe, is very true, is power corrupts, and absolute power corrupts absolutely. I think what happens is you get inside of a system that I don't know what people face. I'm not in the government, but I think there's certain pressures, there's compromises that need to be made. That's the nature of democracy. But I think what he's saying is that we've made government the god. And ultimately, we've misplaced some priorities, and that science should be able to be questioned. And we saw that it wasn't during COVID. We saw very reputable scientists shut down, like Jay Bhattacharya, like Marty Koldorf, and we couldn't question the science. So I think that's the spirit with which the quote was made. And I think that resonated with people so deeply because they did feel betrayed. Locking down people for 2 years and not questioning the ramifications and the consequences of that in the name of quote unquote science, I think was devastating and raised a lot of doubts in people. So,
Reverend Wendy, you wanted to take a crack at it.
Piggybacking off what Jennifer just said, I don't know the context in which, Bobby said that. But for me, what that says is we don't trust the science. We trust what our inner wisdom is telling us. That information can be presented to us, but the ultimate choice relies within us because science is never settled. It's always changing. Question everything should be the motto for everyone. Somebody gives you information, you decide, you go into prayer, you decide, does this resonate with me? Is this truth? Is this not truth? We should be able to ask questions. And what we went through during, that house arrest lockdown was people were penalized and it was punitive. If somebody asked a question, people were maligned. You were a disinformation person, a misinformation person if you were questioning or perhaps had an alternative. So I think that trusting, we pedestalize people. The human nature is to pedestalize people. And a lot of times people in white coats have influence over people's inherent wisdom. So this to me is really telling people to take back your power, to take back your power of thought, to take back your power of decision. And that is where you will find your answers. Bobby talks about he gets up every day. One of his most well-known statements, he gets up every day and he jumps into his shoes and he says, okay, God, use me. And I'm paraphrasing. So for me, that same is you don't trust the experts unless you've done your inner work and decide if this is right. Ask those questions, explore everything, uncover everything, and then go forward.
Dr. Collins, I wonder if I can get your input in this. What do you make of the idea that trusting in the experts is not a feature of science? And how does your own faith help you wrestle with this?
Well, it's a very interesting and important conversation. And as the person who was the director of NIH during 2020 and 21, involved in a lot of these very difficult circumstances surrounding the COVID-19 pandemic, some of the summary conclusions that have been voiced are a little hard to hear. I do hope everybody who's involved in critiquing that would accept that. I think for the most part, those of us who were trying to figure out how to address this worst pandemic in more than 100 years, we're taking imperfect data with a virus that we were learning about every day and trying to come up with some kind of recommendation about how to save lives. So that's what that was about. We made mistakes. The public communication was flawed in many instances. But I do hope that the temptation people might have to assume there was some sort of evil intention will be resisted. Because believe me, at least everybody that I was surrounded by working 100-hour weeks, which everybody was, we're just trying to figure out how to stem the tide of the terrible loss of life that was happening during that time. And I was in prayer so intensively throughout all that experience, praying that God would give us the guidance about what to do that were the right answers. And praying, of course, that the vaccine, which was our best hope, maybe, to try to keep the terrible tragedy from going on indefinitely would work. And I felt that prayer was answered in a remarkable way when the results of the rigorous phase 3 trial got unveiled in late November of 2020, showing a 95% efficacy and a very good safety effects as well. So, yeah, it has gotten so contentious now, and people have gotten so polarized and divided about this, and it's natural human tendency to find somebody to blame. I wish we'd blame the virus instead of blaming the people who were really trying to figure out what to do in this unprecedented situation. But coming back to the RFK quote, I don't agree with the way that this is phrased. I think experts are critical in science, but let's figure out what we're asking them to do. I think this is about truth. I do believe in objective truth, although in our postmodernist world, sometimes people say, well, there isn't really such thing as truth. You can't be a scientist and be a postmodernist. Otherwise, you just aren't going to bother to try to study creation and figure out how it works. You have to believe that there is actually, underneath all of our confusion, objective truth that doesn't care how you feel. It's just the way things work. So I think what experts in science are able to do is to fill us in on what do we know. Not to say that that's all we need to know, or not to say that maybe some of it isn't right, but at least to have a grasp of the facts. And those facts sometimes are really complicated, and they require somebody who's done the work to actually put themselves into the space of understanding that and figuring out how to communicate it. I mean, we don't disagree about this in other areas of expertise. I just had surgery a week ago. I did a lot of work to make sure the surgeon knew what he was doing. I didn't ask my next door neighbor, hey, how do you feel about using a scalpel on me? You don't do that. So in science, the idea that expertise is somehow now being considered as a bad thing, that just doesn't make sense to me. I'm really confused by that. On the other side of it, let me just say, I also don't agree with what he said about the church. At least for me, my relationship about faith is not with the Pope. I'm not a Catholic. It's not with my pastor. I'm an evangelical Christian, and the pastor is a great guy. No, my relationship's with Jesus. I don't need an expert in that space. I need the Bible as my source of wisdom. I need prayer to help me figure out what God is speaking to me, as Elizabeth described the way she was spoken to, and all of you have touched on this. But so I'm just puzzled. I'd love to sit with Bobby and say, okay, can we unpack that statement? Because from where I stand, as somebody who also gets up in the morning and feels like, okay, God, I'm here, tell me what to do, I would not have come to that conclusion.
Well, Elizabeth Frost, do you want to pick up on what Francis just said and try to take a crack at that quote as well?
Yeah. So I totally can read the quote the way that it sounds like, you read it, Francis. And if I read it that way, I think I would feel the same way. I'd have a slightly different interpretation of it because, what I hear is like, that voice in my mind, that moment with God where I'm feeling this direction and this absolute trust that I have that frees me of my own burdens of decision making, that I, in that moment, I feel light, like I've passed this decision off to someone, much smarter and much wiser than me, in this instance, God. And I think, what the point that he's making there, or that how I would take that point is that it's not wise to do that to a degree that it's religious, that because someone is a purported expert on this or because they do have, experience in studying this, we know that, the folks in NIH, we're not the people in the state houses that were making, state level policy decisions that were really, for the most part, what was aggravating and exacerbating people. That's where people felt like their rights were being violated. Were most often happening at the state level or even, more micro than that at city levels. There's this disconnect, I think, between what scientists were doing and how this was being applied. That I think is very, important context, I think, for me in assuming, I suppose, that he's speaking to, COVID ideologies, and the kind of lines that were drawn during the pandemic. What I hear is that these folks in science are not policymakers, and the policymakers are not the scientists. And if we're grouping those two together and making that the expert class, then there's an issue there, in that, you don't have that same direct line of authority that you have in your relationship with God to say, I trust God with all of my heart. You have to trust the scientists, you have to trust the policymakers. And I think that's where it gets complicated.
Hey, Dr. Siegel, I just want to read something from Proverbs, which is, for those who are students of the Bible, it sort of like offers us daily wisdom. And it sort of ties in, I think, to this RFK quote in some ways. It says, trust in the Lord with all your heart and lean not on your own understanding. In all your ways, submit to him, and he will make your paths straight. And I'm just wondering, as again, we consider the RFK quote, are we leaning too much into our own wisdom and not sort of stepping back and letting God's design of things play out here? Or do you take that quote to mean God has provided you ingenuity as a doctor, as a scientist, and you need to take advantage of that to make life better?
Tom, you just set me up with a fastball down the middle. Because this gets to right what I was about to say. I think that humbleness that comes from understanding that God is the divine force would have helped before, during the COVID pandemic, and will help now in response to some of the things that have just been said brilliantly on both sides. And let's add something else you just hinted at, which is the tools we are given. A nod to Dr. Collins, again, with his genetics background and his brilliance. He has a lot of those tools. I have some of them, Emily, all the people on this panel. But the point is, these are tools we're given, and we're supposed to use them, but we're not supposed to overuse them. So if you go back to the beginning of the COVID pandemic, when we didn't have that many tools, there was too much franticness and not enough disclosure and not enough openness about the fact that a 6-foot distancing rule came from the 1918 Spanish flu with a totally different virus. Nobody managed to tell that to the American public. The 6-foot rule of social distancing was from 1918. Second, that the virus was found to be airborne in Nebraska early in the pandemic, and that wasn't revealed to the American public. And that might have explained masking better than was explained. Third, that I agree with Collins on the vaccine. I happen to think it was a miracle, and I think Operation Warp Speed was very, very successful given the time frame. But it also behooved us and behooves us, and this is Kennedy's point, to look carefully at this because it was an emergency use authorization. How did an EUA suddenly become the dogma? And then finally, coming out of that, where we didn't reveal what we didn't know, we weren't humble enough, even if we were, as Dr. Collins saying, battling the greatest pandemic, probably in more than 100 years. Well, the problem with the Spanish flu is it's a totally different situation because we didn't have any tools then, and we had a war going on, and it's hard to make a direct comparison between these two viruses and those two historical situations. But it certainly compares to the Spanish flu. I think that we lack the humility to look for collateral damage. We hyper-focused on a virus as though we knew all. And a lot of damage occurred from children being sent home at school. Why didn't we look at that? And so I feel like maybe we weren't humble enough. And that's to your point. We weren't humble enough. And I fear that in reaction to having not been humble enough, we don't want to go the other way, which is to say, look, if somebody was vilified during the pandemic or censored, they're therefore automatically an expert now. That's not true either. We don't want to replace one period of posturing with another period of posturing. Last point, I happen to think Kennedy, his inquisitiveness and his ability to turn under rocks and to look for things that have been established as dogma is really helpful, because a lot of things that have been accepted maybe shouldn't be accepted and maybe should be relooked at. So that's
Dr.
how I put it together.
Yeah, thank you, Dr. Siegel. Dr. Collins, your thoughts on Proverbs 3? I think you're familiar with it.
I am indeed, and I appreciate you bringing us a little scripture here, Tom. And it makes me also want to comment briefly about the difference between knowledge and wisdom. Proverbs is all about wisdom. There's some other wonderful verses in the Bible about wisdom. My favorite one is James chapter 1, verse 5. If any of you lack wisdom, let him ask of God, who gives to all generously and without reproach, and it will be given. Okay, that's where wisdom comes from. That makes that pretty clear. Wisdom, of course, depends on knowledge. You're not going to be wise if you're willing to accept things that aren't true and sort of pack them into your assessment of how to address a difficult situation. You got to have knowledge, and it's got to be true and right. But on top of that, you have to have some experience. You have to have some common sense. You have to have a connection to morality, which is where I think God comes into it. I don't know where our moral code comes from if it's not from God. It doesn't make sense otherwise. That's how you get to wisdom. And that's, I guess I just wanted to react to your question about shouldn't we just lean on wisdom as something we'll get from our faith and not worry too much about it? Well, yeah, but the wisdom isn't going to hold up unless the knowledge is right. And the knowledge for something like a medical problem is going to depend on the science, and the science has to be right. So to build that whole edifice in order to get it right. I guess I'll do a little advertisement for the book that's over my shoulder here called The Road to Wisdom, if any of you are interested in more about how truth, science, faith, and trust can all work together or not, because right now I think we're not on a great path on that road to wisdom. Well, have a look.
Thank you, Dr. Collins. I want to go to Kenzie. I know Kenzie had wanted to jump in. Go ahead, Kenzie.
Thank you so much. In the spirit of transparency, I feel very troubled right now. And I think it's because I keep staring at this quote and tying myself into these logical knots, because I feel like there are a lot of contradictions embedded in what Bobby Kennedy said, specifically in how he conflates religion and totalitarianism. The first thing that came to mind for me in trying to, as you said, Brenda, we shouldn't try to get in his head, but empathize with this stance, was the way that Christ's ministry often placed him on the hit list of Pharisees, right? And Pharisees were known, especially in the New Testament, as the experts. And we have so much in the Christian community, we have so much adoration for Jesus because he decided, this long-standing traditional expertise needs to be challenged. It needs to be pushed back upon so that we can move closer towards a collective truth. And so I want to say that that's where I almost understand the stance of this quote. Where my opinion diverges, though, is from the fact that, we're not Jesus. so it almost is like taking on this Jesus persona and trying to challenge the experts constantly. Because one thing about Jesus is he had the capacity, assuming he had the literacy level, he had the time, he had equitable access to resources to do his own research. And I think that is the biggest qualm I almost have with a lot of people within the MAHA movement who say you need to do your own research. You need to work on yourself first and then go about finding the information for yourself. Is that this concept of finding the information of yourself for yourself? It's an incredibly high bar to reach. It's a Jesus level bar to reach. A lot of people are operating out of fear. A lot of people are operating out of limited time. We're checking, for example, the Centers for Disease Control website is going to be a lot more time efficient for them if they have kids to take care of and dinner to cook that night than conducting their own randomized control trial or, doing the systematic review to collect data. So I just want to push everyone to think about how this idea of expertise assumes that everybody is able on multiple levels, logistical, social, cultural levels, to so-called do their own research when the information access landscape is so inequitable and so riddled with disinformation in the first place. We were not like Jesus challenging the Pharisees. We're humans challenging other humans. And I think that makes it a little bit more complicated.
Thank you, Kenzie. That really, I think, lit up a lot of people's minds here. Jennifer Gallardi from Heritage, would you like to respond to that?
Yeah, because I don't think it's doing your own information. I don't think they're asking us to do clinical trial researches. I want to point out to COVID specifically, because that seems to be the pain point here. It's that other people that were quote unquote experts in their field, like Jay Bhattacharya, like Ioannidis, both from Stanford. These are not layman conspiracy theorists. These were valid people that understood well, and particularly with Bhattacharya, had also a background in policy. So specifically how the expertise should inform policy. And as a drafter of the Great Barrington Declaration, saying the science doesn't justify the policy, and not being able, and then shutting down those people, shutting down their access to social media, which for better or for worse is a source of information. I try not to use it, but it's really hard with Twitter, with kind of academia being on Twitter constantly and people using it. That was my concern. We're not saying do your own research as to run the labs, do the clinical trial. It was the fact that people that had opposing opinions with good backup, with good data, were silenced. My public policy professor who has an expertise in data analysis, he's not a scientist, but he can look at data and derive conclusions from that, was not allowed to speak. He wrote letters to Cal, and you have to remember, I was in California at the time, which was probably the most drastic of policies anywhere in the country. He was not allowed to offer an opinion. Again, I just want to kind of push back a little on that it's not that we're saying dive into conspiracy theories. It's just the people that had an opposite, conclusion were shut down.
Thank you, Jennifer. Emily, you had said that you wanted to respond as well. Emily Smith from Duke.
Yeah, I think, speaking as one of the experts, I've done 12 years of getting a degree and expertise in epidemiology. And we heard Dr. Collins say the lab is a cathedral, and I see my data coding interpretation as a prayer bench. And I mean that with all sincerity. If anything makes me teary, it's that. Because at the end of the day, if I can read the data correctly and interpret the science, which I have, a decade of training to do, plus another of trying to bring that to the public in a way that matters, it's always, in my opinion, through the lens of the Good Samaritan story, which epidemiology, and we certainly saw that with COVID, this was going to attack certain groups more than the others, and what can we do to collectively come after them or protect them, not come after them? So I think hearing the trust the experts trope that was happening, it was devastating to me, because it's not just a career. It is, I see my science as one of service, and all the scientists that I know, including those who made some of the policies and those at NIH, I know a lot of them are in service of people. And so I think that's the hardest part, is this conversation has gotten so loud at who an expert truly is, that it is really hard to distinguish, those of us who are working 24 hours a day just trying to come up with the vaccine or interpret the data correctly as one of service. So trusting the expert is, like Dr. Collins said, we trust our surgeon. I trust my plumber. We trust a lot of people who have training, but when it comes to science, there's a lot of us that aren't trusted for some ways that we actually should be continuing to do so. Now, for those that I know that there is still disagreement among scientists on how do we navigate forward. We could even talk about COVID, but going forward, there is a rift for sure in some scientists and how they interpret the data. And I would say if we, as people of faith, talk about it through the Good Samaritan story, it takes some of that rift away, because it's again in the service of others. It also maybe helps us talk with others at the table.
Dr. Mark Siegel, you wanted to respond.
There's an assumption made that we're all making it, and I just made it the last time I spoke, that it's essentially what Emily is getting at, but I have a different answer, that somehow the way we communicate and what we assert, whether we're self-proclaimed experts or whether we're more humble or whether we say we do know or don't know. Dr. Collins was saying earlier what he didn't know whether somehow that leads to whether some response on the public's part is polarized or not. But I actually have a different theory that it's too political. I think the politicization of the argument or the discussion is the real problem. I think that we're tied into who's talking to me. Is it a conservative? Is it a liberal? What is their political bent? That's what I know we say, well, we should have been, I'm also saying that we should have been more humble about what we didn't know, and we certainly shouldn't have censored anybody, but that was horrible. But I worry that it's all political anyway, that it comes out on political grounds.
Yeah, Dr. Siegel, and I think what a lot of people are, it's Dr. Mark here, a lot of people are touching on is this idea that we're so disenfranchised. We're so frustrated. We feel so defeated by some of the things that happened and taking that COVID experience and translating it into the healthcare system. And now we're losing faith in that. But one thing I heard from a couple of people here that really struck with me is that so many people actually come to faith through these medical struggles. Like, where you talked about, you didn't have this like deep faith, but then through your children's experience with cystic fibrosis, that's how you came to it. Dr. Collins, you said that, science just made more sense to your medical work than, atheism. And we're in a world where now medical freedom is so powerful, and it's I don't know, an anchor, if you will, for the new administration's views on public health. We're here having a faith discussion, and Dr. Collins, maybe I'll ask you this just because you kind of balance this coming to the table with faith, but also political experience and government experience. How should, faith communities and people of faith navigate this idea that medical freedom is not going away? And especially like when we hear that some of the policies being proposed under this like guise or banner of medical freedom, they don't always align with, core faith values. Like we see these policies, we see cuts to, aid, we see cuts to Medicaid. How do we, accomplish a medical freedom path with faith? Is it possible in this like political world?
Yeah. Well, another Bible chapter I'll have to refer to is Matthew 25. If you have a red letter Bible, you'll know that Matthew 25 is all red letters because this is all the words of Jesus. And there are three parables there. But the third one's not exactly a parable. It's a description of the end times and the sheep and the goats. And there's this very clear exhortation. If you claim to be a follower of Jesus, then you need to have your focus on the least of these. The people who are in prison, the people who are sick, the people who are hungry, who have no clothes, who are thirsty. How are we doing on that as people of faith? I have to bring up, because I'm so shaken by the consequences that have happened in this country in the last 10 months, the dismantling of USAID and the dismantling of the PEPFAR program, started by a Republican president 25 years ago with bipartisan support, which now is estimated, with that very sudden pushing it off a cliff, resulted in an estimated 600,000 deaths in low and middle income countries, 2/3 of which are children. And where's the outrage? People of faith, if you believe in Matthew 25 is talking to us, how can we not be talking about this? How can we basically say, oh, well, those are people in other places, they're not our problem. We're all one family. The Genome Project taught us that. We're all related. How can we not look at what's happening there and feel a deep ache of responsibility? It's one thing to say we're not going to start a new program to help it. We were doing this. We saved 25, 26 million lives already with PEPFAR, and now we're just backing away from it. I'm sorry, I have to bring this up because I don't know how we can talk about science, medicine, and faith without this one on the table.
Thank you, Dr. Collins. I know that Reverend Wendy wanted to jump in maybe to acknowledge that, and then I want to go to Jennifer Gallardi too. Go ahead, Reverend Wendy.
Thank you. Thank you all for what you've shared. I really appreciate it. And I appreciate all of the hard work and the years of study and commitment that you've done and the data that you've accumulated. And I have this question. I've had this question for a long time in terms of, perfect health doesn't come from an injection. Strengthening your immune system doesn't necessarily come from an injection. And there were, if we're going to talk about COVID, there were modalities that were rejected that could have assisted initially very much from a lot of the deaths. And there have been an enormous amount of deaths following related to the receiving of the COVID vaccine. And, making it okay for pregnant women to receive the COVID vaccine. When I was pregnant with my child, I was told not to eat fish. I was told not to have mercury. I was told not to put anything into my body. But then all of a sudden, we've progressed to such a point where if there's a problem, go get a vaccine. But the vaccine, the COVID vaccine, I acknowledge that people worked so hard, but there were horrific reactions. You can go to react19.org. That's just one place. So in terms of faith, the mRNA gene access that changes somebody's cells. It also affected the testes and the ovaries. It's been out there. It's been out there, but there's science that shows that. There is science that shows that, and there's studies. You can read Aaron Series' book. You can read Bobby's book about the real Dr. I'm saying that there's a both and, which is where I like to live, the both and. So I respect what you've done, but there's also information that questions what you're talking about. When there were reactions, myocarditis and pericarditis, I'm just asking the question.
So I do want to so there was a lot you said in there, and I want to go to Dr. Collins for a brief second, but one thing I just want to say on some of the things you said, just having done these calls now so many times, I find that there always reaches a point at which somebody says a lot of data that somebody else is just like, that's not true. And then we get into this sort of cycle of like just arguing about the data. And I will just say that just in my experience, those never really go anywhere. Okay. I'm just here to tell you, I am happy for us to, for Dr. Collins, just because you said a few things and he was involved in that work, but I will have that be the only response and then move forward. Okay. So let's have Dr. Collins just respond to some of the things that Dr. Silvers said, that Reverend Wendy said. And then I'm going to push forward.
Okay, and I will not drag it out. I take your point, Brenda. This is probably not why we're here, is to have this kind of a argument about some of those studies and the other studies that don't agree. I do think, Reverend Wendy, there are a number of things that were cited there that a fully objective review of all of the data without cherry picking from one source or the other would reveal that some of the things that you have put forward are not based upon the evidence. And I certainly agree with you that there's lots of other ways to activate your immune system. But for COVID-19, when we were all sort of bare and not ready for it, the vaccine actually saved an estimated 3.1 million lives in the United States. That's a fact. Maybe somewhere between 14 and 20 million lives worldwide. And the saddest statistic this comes from Kaiser Family Foundation, an objective source that's not part of the government, is that 234,000 people died between June of 21 and March of 22 because they didn't believe the vaccine was going to be safe for them. And they therefore said, no, that's 234,000 gravestones that didn't need to happen. So I'm with you on the divisiveness. How did that happen to a society that wants to help each other, that wants to be aware of the truth and the facts, and yet somehow led to this kind of an outcome that I never could have dreamed of, and it still breaks my heart.
Thank you, Dr. Collins. I want to bring in Jennifer Gallardi to bring us back to specifically two things. One is, in the Bible, as well as in conversations about faith, there tend to be, I think there actually is a home for these conversations about medical freedom versus kind of engaging in a communal project, right? And I wonder, Jennifer, if you can address that. And then specifically when Dr. Collins mentioned what's happening overseas and cuts to USAID and affecting children, I noticed you wanted to comment on that.
Yeah, I think the comments I have will really highlight the difference a little bit between, I don't mean this derogatory, but a more traditional Orthodox Catholic faith and some of the Protestant faiths, which were more prevalent at our founding. For me, I'm not an evangelist. My faith and how I practice informs my decision, but I don't insert it into the conversations as justification for a policy or for helping somebody. I feel like we're all called to do good. Of course, that's what Christ calls us to. But for me, the question is, whose role is it? I think it's more of the civic institutions, and de Tocqueville was excellent talking about this. And he said that we don't have a democracy. We don't have I should say, a federalist system or a republic without kind of these institutions of our community. I'm not saying we don't go out and help people. I just don't think that's the role of government, is to take care of everybody. I don't think that the role of government is to export everything that we believe in America to other societies. Can we help in certain ways? Yes. But I think that our, I guess, beneficent kind of impulses should start as close to home as possible. Our families, our communities, our medical systems. I don't believe that it's the government's job to take care of the world and to take care of everybody. I think we need to retain, I think this is mentioned, I heard it once or twice, a little bit of sovereignty over ourselves, over our communities. Again, I'm not saying you don't help people as much as I'm not an evangelist. It's not my job and again, public health I think we've lost the meaning of public health. We're now telling everybody what's good for them, as opposed to saying, what is good for me, my community, and my family. I'm trying to bring it back to it's just a different perspective in the Orthodox Church, I think, than some of I'm not Jesus. I mean, that was one of the first kind of realizations I had from my spiritual path of kind of this vague spirituality. I thought, if everybody just meditated like I did, if everyone just prayed like I did, that the whole world, we could solve, everybody would be happy, would be all kumbaya-ing. And I just don't think that's reality. I think my job is to fortify myself in Christ, to then go out and do good, but not to kind of preach about it. So I just think it's a very different perspective. And I think USAID got a little off course of kind of exporting some of I've been not trying to use this word, but I just, because everyone knows what it is, I don't want to trigger people, but like we've been exporting some of our woke values outside to the rest of the world that don't appreciate it. And I think USAID got a little involved in that. So I think we need to separate the good work that maybe they were doing in public health from some of the other stuff they got involved with.
Thank you very much for that, Jennifer. Jackie, I want to go to you, and I hope I am quoting Kenzie right here. She said she comes from a faith tradition in her church growing up where God is your doctor, the church is your hospital, and God never loses a patient, which to me sort of brought up, if you believe in life everlasting, our relationship with death changes. That line is very thin between life and death. And we may put so much stock in that. But if we step back and if we believe in life everlasting, maybe we put too much stock in that. And maybe that's, it's okay because we're human and that's what's in front of us and that's what we have. But you have lived a life where that line has been right in front of you with your children. In this day and age, it feels that we, in some ways, are pulling back from emerging technologies. mRNA is one example. Do you feel that that's the right thing? Are you pleased when you see mRNA cuts? Do you feel like that was maybe going too far and maybe tinkering with God's design and God's plans? Or is that troubling to you as you look at that through your lens of faith?
Well, it's deeply troubling, actually, because mRNA is in human trials now for cystic fibrosis, and we've been watching that in the drug pipeline for quite some time. And I think the general public don't understand the true understanding of the science of that and of the long research that has been going on. And perhaps because it was rushed into a vaccine, which my children took, and we did as a family because it was appropriate for our situation, and I think the human communication, the public communication on the science and the delivery and the different aspects of delivery of mRNA, that now suddenly mRNA has been tainted with this like blanket, it's a bad thing, and not understanding the good that it could do for rare diseases like sickle cell anemia, like CF, and for other, treating other complex diseases going forward. That conversation's not being had right now. And I think this is a perfect, appropriate time in medicine to start having these conversations publicly with the public, to understand that there may be a difference between delivering a vaccine that somewhat was rushed, was forced upon many of society across the board. And I do believe that it did save many lives, and potentially my children's as well. But because it was blanketly just given across the board and wasn't tracked, the side effects weren't adequately tracked. And that, I think that that's another part of it, is we need to have an improved system to be able to acknowledge the people who are having side effects, who listen to them, give them voice, even if it may not be coming from that specific, say mRNA shot, but these people are suffering in some way. And I think that we need to listen to them instead of dismissing them, saying, no, it's not from the shot. And even if it's not from the shot, let's unpack that. Let's do the full data. Let's do all of that, improve our VAERS system, improve our FAIR system, because it is abysmal, frankly, and especially with all the amazing data that we have out there, we're not collectively studying that, across the board. And to some of the conversations that you had before and what you mentioned, that I've been in that system as a ravenous consumer for my children, trying to figure out this system. That system has failed my children, and it also has saved my children. So I have this, like, I'm stuck in the middle of all of this, that I need that system to work as well as it can for my kids. Epidemiology is a form of medicine that is important for my kids. The AMRs are increasing. That's the antibiotic resistant microbes in our environment. That is a serious threat against my kids and against society as in general. And we have to really continue to invest in that and discover that. At the same time, to Reverend Wendy's point, is that we do have to also acknowledge that we have to find ways to maximize our general lifestyle and our health of preventative care to make us as healthy as we can when we are exposed to these say elements in life, be it that it's cancer, be it that it's a pathogen, be it that it's cystic fibrosis or sickle cell anemia. I think if we make our own bodies as healthy as we can by the food that we eat and reducing the exposure to toxins in our environment, and having those conversations, we have a better chance to face acute and chronic issues that are coming at us.
And I think that's a point that I think public health or traditional public health would totally agree with you. I think everybody wants maximum number of Americans to be healthier. And I think that tension then is, for many in our community that can't be healthier, are there interventions, vaccines, technologies that could protect them as well? But Dr. Siegel, you want to jump in?
Yeah, I want to talk about global health, because I agree with Dr. Collins about PEPFAR. I think the President's Emergency Plan for AIDS Relief is astoundingly successful. It ties in generic drugs. But here's what I want to talk about with it. I also agree with the point that we're not here to export our ideology, call it woke ideology, whatever. We're not here for that. But we are here, and this fits into the faith discussion we're having. From a Christian point of view, or from the point of view of medical missionaries, to go over to Africa and to bring cheap medication that saves millions of lives, forgetting about USAID, PEPFAR itself is an extraordinary goodwill ambassador program that I believe needs to be preserved.
Thank you, Dr. Siegel. We have about 10 minutes left before we lose a bunch of you. So I want to take this moment to wrap on a thought, which is the idea of grace. And I want you all to think about how grace shows up in your work, in your thinking about ideas that you don't agree with, that maybe even in your heart really kind of tear you apart. Even maybe some things you're hearing here that make your head explode. When I say the word grace, when it comes to things you disagree with or seeing the country perhaps in a way that worries you, where does grace play a role for you? I want to start with Dr. Collins, and then whoever else, just put it in the chat and I'll call on you.
I once was blind, but now I see. Yeah, Brenda, I'm so glad that we're going here because this has, at least for me, been at times sort of a difficult conversation. It does feel like it's a demonstration of how far we are apart from each other in many ways of interpreting, particularly COVID, but not just COVID, and seeing so many of our points of view through the lens of what tribe we seem to currently be aligned with. And those tribes these days are particularly political. And it becomes, therefore, very easy to have that color over your own reactions to what you're hearing or the people that you're going to spend time with, that we become part of the problem by ourselves being unwilling to really listen, to understand the way that we're supposed to do. And that means we have to figure out, once again, how to put grace into this situation. Grace that stems from our faith, that stems from our exhortations in the Sermon on the Mount about how we are to treat each other, how we are supposed to not so much admire the people with power, but actually blessed are the meek, blessed are the peacemakers. We're called to be those people. And that takes probably more than I can manage sometimes within my own humanity, and it requires sort of calling upon faith to say, okay, God, you're going to need to help me here because I once was blind and sometimes I still am, but now I can see if your grace can come and join in my heart. And sometimes that means God has to be strong because I'm weak, and I'm weak lots of the time. And so a conversation like this is a great reminder of that.
Thank you, Dr. Collins. Elizabeth Frost from MAHA, how do you think of grace in this context?
My mind goes to, speaking of my grandparents again, this little plaque that was on the wall in their hallway that talked about how you can never truly know a man unless you've walked a mile in his shoes. I think that's what grace has become about for me is, I can't go back and live Francis's life. I can't go back and live Bobby Kennedy's life, but I can try to deeply understand, how both people got from A to B. And when you do that, in my experience, it's really difficult to not walk away with a deep sense of empathy, for everyone. I think when you have that sense of empathy, it's much easier to forgive when we think someone's maybe amiss or, interpreting things wrong, or, let's just say it, doing something that we think is flat out harmful, right? I think there's a lot of folks in public health that think that, things that Bobby Kennedy does is causing real harm. We talked about, the estimated amount of lives lost attributed to, the USAID funding being cut. But to me, when I look at where people are coming from, what I walk away from these conversations is that everyone has a deep love for the community, for the world, and that all of that anger is coming from a place of love, which is, I guess, the great irony of what we're all doing here.
Emily Smith from Duke.
Yeah, I love this conversation. And I do think grace for me is the empathy part. You know, it is really hearing, but it like everything, it comes down to neighboring. Like we can neighbor one another in these conversations. But we can also neighbor, like I just feel so deeply about what I do with these children with cancer in Africa. And that is 100% affected by some of these policies. And so on that level, there's grace in the journey to keep going, and despite some discouragement that could come. But I think in these conversations, and especially moving forward, I just loved what Elizabeth said of the, like, you can understand people and have some of your values that are still deep rooted while being neighbors. And it is just complicated and messy, but it can be lovely too. But it doesn't have to be all the time. I think there is grace for walking away from conversations that can be really hard, but also entering some like these that can be a space where you can actually have some of the words that need to be said with your own heart.
So let me go to Dr. Siegel next.
First of all, I thought Elizabeth Frost's comments were terrific and spot on. I want to just relay quickly to something from my book, The Miracles Among Us, which includes in its subtitle, God's Grace Plays a Role in Healing. And of all the miracles that I write about, I think the one that struck me the most in this regard, and it speaks to Tom's point before about humility, and that's what we all need, and the kindness and humility that makes this conversation today so amazing, is that in my chapter about October 7th, the family that survives having their house burned down by Hamas, and they save a little baby's life, their little baby, and they survive months in a coma in Sheba Medical Center, and they're covered with burns and they get infected and they have blood clots and all of this stuff. And I said to them at the end, how do you feel with this miracle that you've experienced? And they said, we don't see ourselves as having had a miracle, because if we do, then we're dishonoring those who didn't make it, our friends who didn't make it. And that's God's grace being transmitted to people. And I feel that humility really resonates. So thank you for this great discussion.
Reverend Wendy.
Thank you, Brenda. And thank you, everybody. I really enjoyed being here and appreciate all that I've heard. I think about grace in many different respects. For me, it's a feeling tone. It's not a thinking, it's a feeling. It's a feeling when I walk into a space and I feel welcome. It's a feeling when everything that I've been holding falls away. It's that moment when I move into prayer and I'm just completely open and receptive to the flood of God speaking through me. You know, I want to say, when Brenda and I first spoke, I said to her that besides anything that I do, I'm a mom. And so this reference to tribe or politicalization, for me, mom trumps it all, because all I ever wanted to be was a mom. And so I took being a mom very, very seriously. And I birthed my daughter at home and I breastfed her to 3. That's grace. And I made decisions for my daughter that were very much in alignment with my values before there was a MAHA. Because for me, God's grace was really listening to what my child needed, what I needed to provide for my child. I think of, Yeshua when he said, love thy neighbor as thyself. He did not say love thy neighbor as thyself as long as they look like you, love like you, voted like you, made choices like you. He just said, love thy neighbor as thyself. So we get to come here in this circle, this virtual circle, and be that demonstration. So that to me is grace. The St. Francis of Assisi prayer that he didn't really write, but it's always attributed to him, is talks about, let me seek to understand rather than to be understood. And I think so many times what causes the divisiveness is everybody is waiting for that last, that breath to be taken. And I'm going to jump in there with my point. So grace is letting go of agenda, letting go of position. I don't know what another soul's journey is, but I know God does. So I lean into that.
I'm going to go to Kenzie next.
For me, my biblical understanding of grace is unmerited, undeserved favor from God. And as a result, grace to me means accountability. It means responsibility. It means a call to action. I will say that the United States of America, across time and geography, has been afforded a lot of grace, a lot of unmerited privileges, resources. And that is why I strongly believe, and I really wanted to make sure I said this during the conversation today, that it is then our responsibility with that undeserved grace to then be able to reach out and through various forms of aid, do what we can to benefit other communities in the global health landscape and otherwise. Grace looks like having an opportunity to right your wrongs and reconcile with your harmful interventions in other countries. It means being able to do that when second chances are not necessarily a given in this life. That's why I always believe that the United States, when it comes to USAID, for example, we have a responsibility in the spaces where, if you look closely, there's been significant amounts of meddling from just the quote unquote Western world in general to engage in what is actively reparative justice. I think that there is a lot that we as Americans owe in this world, as people who even have the privilege to be in this space and have this platform. And I just hope that we all take the opportunity to use it to reverse some of the inequities that allow us to be in this space right now, but like systematically push other people out. Now, from a more personal level, I've seen grace take place in my life because I've had this long-standing interest in studying, especially in Black youth, anxiety, depression, studying metabolic syndrome in Black and Brown communities. My current PhD dissertation focuses on pathologies and treatment pathways for binge eating in the Black community. Just in January, I was diagnosed with polycystic ovary syndrome, PCOS, and some of the biggest symptoms of that are, surprise, metabolic syndrome, anxiety and depression, binge eating. And so for me, grace showed up in God telling me the reason that you're interested in these things, that you have a vested curiosity in these things, is because you're actually going through them. And yes, it took nearly 8 years for me to receive that diagnosis, and there's not enough time afforded to unpack that here. But the grace comes in receiving the diagnoses in the first place, and then using that responsibility to be a health educator, to encourage people to share their stories, not allow themselves to be medically gaslit, which is kind of a common theme that I'm hearing across a lot of people here. A lot of us are coming from places of hurt from medical gaslighting. And that's why we're here talking about, the novelty of MAHA in the first place. Like, I see it and I fully understand it. But I think the question is, are we able to use political, social mechanisms like MAHA to heal ourselves, but also think more critically about what we owe the world with, like, the privileges that we actually already have been afforded.
Thank you, Kenzie. I want to thank you all for joining this. Someone once asked me why we do this, and on some level, I've always said it's an effort to sort of reintroduce America to itself. And what I mean when I say that is, like, this is who we are, these are our countrymen and women. And sometimes we agree, sometimes we disagree, but we got to live together and we got to figure out how to do it, And so this is just a step in that process of coming together to even have the dialogue. There are clearly differences, and they're difficult differences. And sometimes I'm not even sure we're going to work through them. But the truth of it is, it's like you miss all the shots you don't take, right? So I'm just here to thank you all for joining us in what I hope will be many conversations. Hopefully you all will come back. We'll do it again. I want to thank Kenzie Isaac for coming up with this terrific idea. It was kind of birthed in her brain, maybe when she was sleeping. I don't know how it came to her, but here we are. Thank you, Kenzie. I want to thank Maggie Bartlett, Mark Abdul-Malik, Tom Johnson, co-host of Why Should I Trust You? I'm Brenda Adhikari, and a huge thank you to all our guests here. You can read all about them in the show notes. We'll have lots of good information about them in there. Please send questions, comments to questions@whyshoulditrustyou.net, and we'll see you right back here next week.